Hello, this is Dr. Jill Moore at Concierge Medicine of Columbus. We're taking our first adventure into the YouTube and recorded video arena for dispersing information for our patients. Dr. Hudson wasn't able to be here today, but we did want to try to share some information with you about recent coronavirus issues in our area specifically. There's been a lot of legitimate concern about it, so we wanted to try to answer some questions that we have received from patients and see if that's helpful for anybody else here locally about that. I'm not going to spend a lot of time on the history of this virus. We do know that the coronavirus, or COVID-19 they're calling it, is originated from Wuhan, China. Since it has been spreading, began around in November sometime, that it appears as though it has mutated at least once that they can identify. But there is some fantastic information available about most all of this on the CDC website. And that is a great resource that even the physician offices are looking to get recommendations about how to do different things as the conditions evolve and necessitate us to change how we are practicing currently. So I did want to share some other thoughts about care for people in the Columbus, Georgia area for our patients. We may even have to make some modifications to this even after today. We'll try to get that information out. If there's any questions for our patients, of course, please call the office and talk to our nurses. April and Tiffany are glad to take your questions and relay them to me and Dr. Hudson and see what we can do to get the best accurate answer for you. We actually do have access to test kits now, that if we have a patient who is concerned, suspicious that they may have been exposed, we do have the ability now to collect that sample. So I'll kind of go through the list of questions here and see if there's anything else that we need to cover. We'll try to get that, and we could do an update at a later date, maybe Monday if we need to. So patients have asked about what to do with medications as they are making nationwide announcements. There could be shortages of those. They are mostly, or most of them are manufactured at least partly from at least Chinese components. Pretty much all of the antibiotics are dependent on Chinese facilities of some type. So if they decide that they don't want to share with us, then we would have some issues getting new antibiotic orders for our patients. I have not known of any specific back orders of that yet, but there's a possibility. There's no recommendation for any patient to stockpile anything antibiotic-wise. There may be some back orders for people who really need that with an urgent condition, and they couldn't get it if people are trying to save it away for a rainy day at home. But for your regular medications, if you have critical heart medicines or if you have critical other diabetic type medicines, you may consider getting an extra 30-day supply on hand, as some of those may come in short supply. I have also heard from some people who live in Atlanta that their grocery stores are already shut down. I'm not trying to create panic. You do not need 6 months worth of toilet paper or hand sanitizer or shampoo for this, but you may want to plan on just a couple of weeks of supplies. The stores will be getting new shipments here, so we expect that you'll still be able to buy toilet paper next week. I've not heard any rumor of local grocery stores shutting down for that, but we hope for the best for everybody there. The food supplies, I've not heard any shortage in the area of food-related products, but for anything critical that you know you may need, you may want to try to get a 2-week supply, is what their current recommendation is for that. So again, refer to the cdc.gov website for most of the background information. And everybody's heard this about wash your hands, don't wipe your face, touch your nose, do use the cleaning wipes on the on the shopping cart handles when you're going in. Any public doorknobs, be sure to clean your hands thoroughly. Gas pumps, use alcohol, hand sanitizer. Those do work well. How long does the virus last on various surfaces around the home, including wood or plastic, linoleum, countertops, faucet handles, those sorts of things? And I've heard just this morning from a representative of the CDC, also getting some updates from Dr. Fauci, who's been contributing to the White House staff on this, that it can live in the air for up to about 3 hours. It can live on surfaces maybe even 8 or 9 hours. They have determined that the Lysol and Clorox brand products are good at killing this. However, the surfaces may have to stay wet for 10 minutes with the product to be 99.5% effective as advertised on the can. So just keep that in mind, but do try to keep all of your hard surfaces in your home clean daily, including countertops and doorknobs, and think about your car handles and steering wheels, such as that. And try to avoid touching your face as much as possible around your eyes, nose, and mouth especially. So other questions here from patients we've had, how to get tested. There is not an unlimited supply of test kits. We have a very small number that we will have to be very particular in who we choose to test for this. Specifically, if you've had a known exposure, then you would be a high priority person if you have current symptoms, including at least one of the above listed things, including either fever or cough, shortness of breath are the 3 main symptoms that are discussed on the CDC website regarding this. But some people may also have a sore throat, or they may not have much shortness of breath or any at all. Now, that said, there are cases of people who are infected and they do not have symptoms, and yet they are contagious. And that is the biggest reason for what they have described on the news reports as social distancing. So that's why all of the sporting events are canceled, and my girls' dance recital has now been canceled. They were supposed to go to Montgomery, and I just heard the first case in Montgomery has actually been confirmed. So all of these have happened. Local school districts are closing their doors already. I've heard rumor, haven't heard firsthand, that Brookstone School has closed. I have seen reports from employees here that Harris County School District will close until April the 6th. I'm not firsthand knowledge of that myself, but do keep updated for that. We hope to get reports soon from Muskogee County and other local private schools about that as well. But as far as a patient of ours who thinks that they should be tested based on an exposure plus symptoms, please do call the office if you think that you need to be tested, and we will use our best judgment to use our test kits sparingly for now, because we don't have many, but we do have some. We will have you to call the office specifically because we do not want you inside our building. We have already had a patient at our building to have a sample collected, and that person was met at their car, that they called ahead as we wanted them to do, and they stayed in their car, and we had an employee to put on the gown and mask and gloves and eye covers to be able to meet that person at their car, collect the sample, and then they were able to drive away and leave. I think that was collected on Wednesday, and we're not expecting a result until Monday on that. I don't know, or I wouldn't be able to share with you the history of that person or where they had been in the Columbus area, but they had a known positive exposure in the state of Georgia. So we hope to be able to have a known yes or no answer on that by Monday. We just checked with LabCorp about that, and there is not a result as of current time at 12:55 p.m. here on Friday. So if a patient of ours needs to be tested, call ahead. Let the doctors here determine if you are a good candidate for testing. Make sure we have a test kit available still, and that we will make arrangements to meet you at your car to collect that sample from you. It includes both a nasal swab and a throat swab that are sent off. These tests are very accurate, that it is actually a genetic test for the virus. So if there's a match for genetic material of the virus, that's how we know it's just that it's not the flu. At the same time, we would probably also suggest let's test you for influenza, as that is still much more common in the area, and we've still had positive tests at the office even this week. So if your flu is positive, we can still consider, based on your exposure history, if you need to be tested for coronavirus itself. also. So if you are suspicious that you have been exposed, and if we don't have an answer on a test kit for you, or if you think that you're sick enough that you need to go to the emergency room for your significant shortness of breath, high fever, cough, such as that, we encourage you to call that ER before you go there and make sure that they have capability to take you in there. They absolutely do not want you walking in that building with uncovered face mask, whatnot. The regular paper surgical masks are not adequate for this. They would rather you stay in your car and call them from the parking lot that you have arrived after you've discussed ahead of time that you were going to come there, and that they would meet you at your car, make arrangements to cover your airway, and they would be protected as well in the gown, glove, mask scenario garb, that they would then escort you into the hospital if they have space available to take you to what they call a negative air pressure room, that it sucks all of the air from the room through a HEPA filter before it goes outside. But just a regular standard hospital room would not be adequate for patients with that. So that being said, we want to limit our hospital requirement of patients showing up unnecessarily for testing. They don't have that much testing capability either. And we certainly don't want to flood our hospital with people who don't need to be there. We may end up with situations like I heard rumor that in Italy that their ICU patient beds have overrun flu vaccine to give you any protection at all. We do still encourage our patients to consider if they need to take a flu vaccine for this year, as we expect flu to circulate. It's been into April the past couple of years, so there's still some available for the regular dose. Here at the office, I think we have a few left, but the high dose is still available at the local pharmacies if you wanted to protect yourself from that as well. It's also important to do. So I'll get to some other questions here that patients have submitted about this. Is there anything that I can take medication-wise to avoid getting coronavirus? So again, there's not any antiviral type medication that we have available to us to use for anybody. There's none proven yet by the FDA, and certainly not commercially available to get. There have been reports that we encourage people to drink a lot of water, that keeping your throat moist and keep swallowing water from the back of your throat helps to keep the coronavirus from being able to attach there to become a source of infection. Don't know if it would help, but consider vitamin C supplement, possibly the zinc throat lozenges could be helpful. It's one of those things that it might help, it probably won't hurt. There's some evidence that zinc might help to reduce viral transmission that way. Next question, do I need to get a 30-day supply of my medications to keep on hand? For those with critical medicines, heart medicines, diabetic related things, other chronic ongoing medicines, that's not a bad idea. For people who just occasionally need things here and there, over-the-counter sort of things, there's no need to stockpile those. We don't expect any shortage. And we do ask people, do not stockpile antibiotics, because the virus doesn't respond to the antibiotics, and people who need them may not have access to get them if they're in somebody's bathroom cabinet at their house. All right, next question. If you have compromised lungs, do medicines like albuterol nebulizer and Mucinex help if you become symptomatic? If for people who might get infected with this virus, all we can offer is symptomatic treatment. So Mucinex may help if there is some mucus congestion in your lungs, or the cough suppressant might be helpful. I don't know any of that firsthand, but I would suggest that it's definitely worth a try. If you had shortness of breath related to this, albuterol nebulizer, if you have access to that for those with asthma or other type lung conditions, may benefit from that. Other than that, we just don't have much else to offer. Just do stay hydrated as much as possible. And definitely try to avoid contact with others if you think there's any chance you may have been exposed. Okay, I'm back. Sorry about that. Tune into the next section here. I'm not sure why that cut off. Any case, is there a vaccine that's going to be helpful for this since the virus has already mutated once? We have heard first-hand reports from the White House consultants on this that the virus has mutated once. I forgot the letters they're using, a M and an L, maybe, I don't know, for the different strains of this virus. So by the time they're able to develop a vaccine, is it going to be helpful? We have no idea, and it's hard to say because we know how the flu virus mutates every year. So whenever they create our flu vaccine each year, they're hopeful to guess the right strains to include in that vaccine. And some years it's a good match, and sometimes it's less helpful than we hoped for. But it will be a while before there are vaccines that are proven to work. I've heard rumor this morning that Canada may have a vaccine, and people are urging them to push it out, but we have no idea if that vaccine's helpful or not. So just to go take a shot of something that may not help, we wouldn't want people to have false security that they're protected and to go expose themselves unnecessarily to people who might actually still make them sick. And then they would potentially expose others who are susceptible that may have problems as a result of this. Another question here, if a 71-year-old female with congestive heart failure, should that person be concerned or considered at increased risk? Definitely. Anybody with heart failure should be considered at high risk because this type of lung infection can cause a type of fibrosis. The fibrosis would make you have shortness of breath because your work of breathing would increase. It would require more muscle effort for you to be able to take a deep breath and exhale. That does put extra strain on your heart muscle. So that is what would potentially aggravate the problem for somebody with congestive heart failure. It could cause a worsening of their symptoms or an exacerbation of their congestive heart failure. So they potentially would be at risk if they were infected. Also, anybody who's diabetic is considered increased risk. Anybody with history of myocardial infarction for the same reason as congestive heart failure would be considered increased risk. Anybody who is a cigarette smoker, if you have COPD, obstructive pulmonary disease, then you're at increased risk. Anybody taking chemotherapy is definitely at increased risk, and any of their caretakers should also be vigilant to make sure that they don't get infected and bring that into their home where they may expose their loved ones who are very likely to have a worse outcome than us. Should this 71-year-old female with congestive heart failure delay an elective procedure? You may consider to do that if you expect a hospital stay associated with it. You may not want to spend much time in the hospital if you can safely delay an elective procedure. Other things such as dental work, you would potentially be at close range with another person that may not have symptoms, but they potentially could be contagious, even with just a paper surgical mask. Something to consider for that. So let's see, anything else? Trying to see what else to cover. Oh, the N95 masks. We do not need the general public to stock up on those. We have had extreme difficulty even for our office getting access to those. We have those available in the event we have a strongly suspected exposure in the office, and that will enable your healthcare providers to care for you here at the office. That is not for general population people to walk around with. For those of you who have never worn an N95 mask, they are very difficult to wear. They are very tight on your face. It must have an airtight seal. They are very hot to wear underneath your area, your nose and your mouth. To wear it for 1 hour, you will notice a significant increased work of breathing, that it is very difficult to breathe through that mask. It is not something to just say, well, I'll put that on and ride through an airport issue and just keep it on for 6 hours continuously. That is very difficult to do for anybody with good lungs, much less anybody with compromised lungs. Should not attempt to do that. Just stay home, avoid any unnecessary air travel, avoid any unnecessary crowds, or social distancing, as it has been called, to try to limit any exposure to our patients and keep our family members healthy. And hopefully this will blow over in just a few weeks, but we want to keep as many people out of harm's way as we can. So the social distancing is more about protecting the susceptible people from younger people who might be infected and contagious, but minimal symptoms that are possibly confused by some as allergies, not to expose their parents and grandparents and other susceptible people in the community. So we want everybody to take care of themselves and use hand sanitizer when it's available, and use plenty of soap and water is a great way to keep your hands clean. If soap is not available, but you do have running water, just wash your hands well with just plain water. Just scrub them hard, and that does a really good job just by itself, as much as you can. Avoid touching your face, particularly your eyes, nose, and mouth if your hands have recently touched any surface. And y'all stay safe out there. Take care. Call the office if you have any questions about your specific condition or need to get refills on medications. Let us know. We will try our best to accommodate those. Please be patient with our office, as we may have a temporary nursing shortage, as if their schools close and the nurses have to be home with children, then we may be running on short staff at the office. We'll do our best to keep up with returning phone calls as we're able. We're trying to work out how we can have a nurse possibly take a laptop computer home if they could possibly return phone calls from there, or be able to refill medicines to try to keep up with what your regular needs are for your health care. We're also going to offer here possibly just televisits or FaceTime follow-up visits for routine health conditions rather than requiring an office visit. So maybe you'll get a call from one of our nurses about your option to schedule those differently if those are coming up here in the next week or so. So again, everybody stay safe. Call us if you have any questions. We're trying to do our best to stay on top of this. So everybody be good. And until next time, take care. Thank you.